Training while on chemotherapy is something that was pushed quite hard last time I was on that treatment. At least 1.5 years ago I started it in the summer. By the nurses, the doctors, my therapist and surgeons. And this time my therapist talked about it, but she knows that I train or try to train. But the nurses were not that talkative about it, and in the pamphlet with my schedule and all the information about the chemotherapy, there was no information about it. So I started to dig around a little bit. Yesterday I asked for that information from the hospital, and I received a separate pamphlet that they must have forgotten to give me. That they must have forgotten to give to quite a lot of people, because when I talk to other people that are on chemotherapy or know what people who are on chemotherapy, they seem to be not exercising. They seem to be sitting home, not doing anything. So there seems to be some kind of misinformation here going around. I read through the pamphlet and it quite clearly stated that to activate the body when you're on chemotherapy helps against the fatigue and other side effects and nausea. And then it went out to list different forms of activities that would be good, like walking, as I try to do, jogging, running, if you have the energy for that, and cycling, swimming. I think it said Pilates, yoga, Tai Chi, and then strength training. And if you are in doubt of anything, you should talk with your contact nurse or doctor. So that's good. That's really good information. And it said that all the latest research pointed towards the benefits from training together with chemotherapy, not only against the side effects, but also that the chemotherapy itself would be more effective. So this intrigued me. So I started to try to find these reports, and what I found was, I'll link this on the description field. Turns out that the earlier recommendation was for cancer patients to not exercise, to save their power for the treatment, save their energy for the treatment. And today it seems to be the other way around. I read somewhere that it's almost counted as malpractice to say that today. And if you could put the benefits from the exercising into a pill, then everyone would want it. But not everyone wants to exercise, so I guess it's the human laziness that comes together with all this. I don't know. tell me what you think in the comments. Why things are like they are when it comes to exercising. But I think it was on MD Anderson. It's a university in Texas, where they had done research on mice that received chemotherapy for some cancer form. I think it was pancreatic cancer. Well, hard tumors, at least not soft. So the biggest issue with hard tumors was that the blood vessels were not developed enough inside of them. So it was hard for the chemo treatment to reach the cells inside of the tumor. But when the mice started to exercise, the structure of the tumor and the structure of the blood cells inside the tumor started to change and become more developed, and hence allowing more chemo to pass through. And then they did a similar study with humans and found similar results. So that's really interesting, as it was transferable to humans. I heard something that if you treat cancer in a mouse, everyone can do that, but it's a transfer of that information to receive from a mouse and make it work in a human. That is the big leap. So that was really interesting. I think that was the MD Anderson study. Next out was health.harvard.edu. I'll link that as well in the comments or in the description. The study was named "Exercise as Part of Cancer Treatment." It was from their blog. Clinical Oncology Society of Australia. They basically have done some clinical trials with women with different stages of breast cancer, and found that exercising during treatment significantly improves quality of life, fitness, energy, strength, as well as significantly less anxiety, depression, and lower body mass index compared to regular care groups. And they actually provide numbers on how much you should exercise from what they used in the tests, I guess, or in the research. Avoid inactivity and be as physically active as they are able, with a goal of at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic exercise, meaning walking, jogging, cycling, swimming each week. And then 2 to 3 resistance exercises, like weightlifting and strength training. This translates to about 21 minutes per day of exercising. And for example, if I go out walking 2.5 kilometers, it takes me around 30 minutes. And it's considered moderate. I run for 1300 meters the other day, took 15 minutes. Or walk. It was slow. So the best exercise is the one that actually gets done. And then we had an interesting one, because I have issues with my toes from the nerve damage. the neuropathy, probably. It's from ScienceDaily.com. Chemotherapy and exercise, the right dose of workout helps side effects. The summary of researchers discovered something simple and inexpensive to reduce neuropathy in hands and feet due to chemotherapy. Exercise. The study involved more than 300 cancer patients. And then something that I did not know either was from the European Society of Cardiology. Cancer patients who exercise have less heart damage from chemotherapy. Evidently chemo affects the heart, so no big surprise as it affects all the cells in the body. But I didn't know that there was a heightened risk for cardiac diseases for cancer patients, but endurance training is more effective for improving cardiovascular performance and reducing inflammation, but resistance training may be a better starting point for frail cancer patients, says the doctor they are interviewing regarding the study. Other types of exercise, such as inspiratory muscle training, are safe and effective, particularly those with thoracic cancer. Therefore, the specific exercise should be chosen based on individual characteristics. And cardiovascular diseases are common side effect in patients with cancer. This is the result of cardiotoxicity, where cancer treatment impairs heart function and structure, or accelerates development of cardiovascular disease, especially if you have high blood pressure. And Dr. Aseni concluded that the physical activity before, during and after cancer treatment can counteract negative effects of therapies on the cardiovascular system. In addition, it can relieve symptoms such as nausea and fatigue and help prevent unwanted changes in body weight. So the fatigue and nausea and body weight is recurring in all the studies, it seems. There are multiple ones of them. So, yeah, I actually found a totally new article in the Washington Post as well. The article's name is "A Young Cancer Patient Found an Exercise Bike Helped Him Endure Chemotherapy. Now he wants others to have the same chance." There they say that chemotherapy wreaks havoc on the body. It causes fatigue, muscle loss, nausea, pain, disrupted sleep. Oh shit. But regular exercise can help minimize the side effects in cancer patients. Evidence has shown, and there's a link somewhere, that consistent exercise routine can reduce cancer-related anxiety and fatigue, and it can reduce repressive symptoms both during and after treatment. Doctors are spreading the word that exercise improves quality of life and that patients need to stay moving after the treatment concludes. And then there's a lot of what this kid did to help others. Really an interesting read. I'll link that one as well. So, in conclusion, 21 minutes per day is not that much. Just do it. Or don't. It's up to you. For me it has helped. Was the previous time when I was on the chemo for 6 months with the pills, it helped with the side effects with the fatigue and nauseousness. And this time it's the same. And what keeps me now motivated as well is I know that I have a heart tumor, locally advanced heart tumor, and if if there can be a structural change in that so the chemo can come to it more effectively, I'm all for it. I'll just keep on walking, running, doing stuff, yoga, weightlifting, just keeping the body moving, keeping the body moving. Okay, this has been a bit longer clip this time. I thought that this was an area that really fascinates me and keeps me going, helps me find motivation for keeping on exercising, so I think it's worth to spread it. And hopefully doctors here in Sweden will be better at spreading the information as well, because this time it was lacking. Thank you for listening. And a last disclaimer, just don't take information from the internet and run with it. Just talk with your doctor before you make any changes to your treatment, even if it's only adding exercising. See what they say. Be smart. Don't forget to like and subscribe.